Perfect. And now we're going to continue today's presentation with Dr. Barstow. So I'm going to quickly introduce Dr. Barstow and then pass things over to her. Dr. Barstow is a diplomat of the American College of Theriogenology. She's an active member of the Society for Theriogenology as well. Dr. Barstow practices in small animal medicine in Lakeland, Florida, and is the only reproductive specialist serving the greater Tampa, Florida area. In her practice, Dr. Barstow works with dog breeders to breed healthier dogs. She's a longtime breeder of Samoyeds and participates in dog shows as well. So with that, Dr. Barstow, I will pass things over to you to get the bulk of today's presentation started, which is tackling common reproductive emergencies.
Perfect. Thank you so very much for that. I greatly appreciate that. Let me go ahead and get into my screen sharing there. And slideshow going. There it goes. Okay. All right. Now that we're up and running, get my little laser pointer so you guys can see. All right. So as Nicole said, I am here in sunshiny Florida with my Samoyeds. I did vet school in Minnesota, and I did my intern or residency at Auburn University. So my quick little bio pic there for you. All right, so what we're going to be talking about today, going to be discussing some dystocia management, going over different reasons for medical dystocia, how we can treat those medically versus treating them surgically, as well as treating pyometras either medically or surgically, some post-whelping complications, and then touching on a few male-specific emergencies here. So starting with our dystocia topic. So why do we have dystocia? What causes dystocia? There's a couple of different reasons. So they can have what's known as a primary uterine inertia. So uterine inertia is where the uterus muscles are either tired or they don't contract like they're supposed to. And so with a primary uterine inertia, they just don't go into labor and they never do what they're supposed to do, unfortunately. Secondary uterine inertia is that bitch that has, the 10 to 12 puppies. She's going every 2 hours between puppies. So you're hitting 24 hours by the time she's getting near that end. And she's just tired. That uterus is tired. And so that's a huge reason we can see dystocias as well. Other reasons that we can talk about, Dr. Hessler already mentioned Anasarca for our specific breeds. And we also know that the size of the puppies, so certain breeds have big, broad shoulders. So like our Frenchies and our Bulldogs, and smaller heads, and those shoulders are what actually get stuck versus actually just having some fetal oversize. So if you have a smaller litter with 1 or 2 puppies and a bigger dog, those puppies can have that tendency to get bigger than what they're actually supposed to happen. So when we have a dystocia that comes in, we've got a couple of different options. We can, have the little arm that's just kind of hanging out there, just waving at us. Or we can have the bitch that's just kind of, she's tired and she's been doing this for too long and she needs assistance. So if you guys heard my talk the last time, so this is my canine vaginal tract. So this area here, so we got the anal opening there where we've got the vulva. If we're going in and we're doing our digital vaginal exam, and some of our larger dogs, we're not able to actually reach to the cervix that's up here. So that just doesn't really work very well for most people to be able to feel that, because that's above the bladder inside the body there. But however, when I do have a dog that comes in for a dystocia, I'm absolutely going to do that vaginal exam. Can I feel something? I'm also checking to see if I've got any green vaginal discharge. So in this image of the placenta, you can see that beautiful green line that we have on either side of the placenta. And that helps with iron transport while they're in utero. But when I see that green, that means I have placental separation. So if the bitch hasn't had any puppies yet and we've got green vaginal discharge, then I'm going to be a little bit more concerned about everything that's going on in there. However, after they've had 1 or 2 puppies, I can no longer be looking at that vaginal discharge as what's going on, because I expect to have placenta separated since she's already had some puppies. I'm also going to be checking for what's known as a Ferguson reflex. Is when I go in there and I feather inside that vaginal cavity, does she still contract around me? Also going to be looking at doing some x-rays and some ultrasounds on them as well when they come in for these dystocias. So obviously in this x-ray here, we have our little puppy with his head kind of stuck, and then I've got a front leg here, and then my other front leg down here. So he's not out in that beautiful little Superman position like he's supposed to be. Those shoulders are stuck. He is not going to be making it out. This is something we're absolutely going to be going straight to C-section for. However, when I get this x-ray, maybe. So you may or may not have felt those little feet that are right in there when we did the vaginal exam, but this is, nobody's stuck, could potentially, consider medical management. So how do we make that decision? So obviously when I'm looking at my x-rays, if I have more than 3 puppies or more than 2 puppies, I am highly likely to take this to C-section just because of the time in between having each puppy. We know we're going to be dealing with a longer thing, especially if the bitch is already tired and she's coming to me. If I have less than 2, we can absolutely consider medical management as long as nothing is stuck. So unfortunately, in that first x-ray that I showed you, we had that puppy that was stuck. That's a no-go. We're not going to try medical management if anything is stuck. We're also love to have good medical management if I have a positive Ferguson reflex. That means when I feathered her, she's still contracting, so things are still working like they're supposed to. The other thing I'm going to do is okay, so we've got 2 puppies in there on our x-ray. What do these puppies look like on ultrasound? Do I have a normal fetal heart rate? All right, so the fetal heart rate that you can see here that's playing is absolutely a normal fetal heart rate. That puppy is not stressed in any way. If that fetal heart rate starts to get lower and lower, then maybe we're going to be better off actually going right to surgery to get these puppies out a little bit faster. So we're not having to worry about these puppies being any more stressed than they already are. So now when we do medical treatment for these girls, we're going to give them oxytocin. This can be repeated twice, 15 to 20 minutes apart. If we have no response to oxytocin, then obviously we're going to convert to a C-section. I do recommend highly giving them calcium as well when we are doing our medical treatment for them. If we have to go to C-section because we have still a large number of puppies to go, or the puppies are stressed on that ultrasound, it's not a wrong decision. And, as Dr. Hesser had already mentioned, that was a great question that we already had. Just because we've had one emergency C-section doesn't mean that we can't go ahead and try to free whelp. Now, for me, after we've had 2 emergency C-sections or even 2 planned C-sections, I do prefer that the bitch has nothing but C-sections for the life of her breeding career, just because then I've got 2 potential weak spots in that uterus that can then set them up for failure. All right, moving on to pyometra. So pyometra, pus in the uterus, everybody's probably seen this. So what causes pyometra? So when dogs come into heat, they have that high progesterone, regardless if they're pregnant or not. They're cycling every 6 to 7 months. This sets up the uterus for something known as cystic endometrial hyperplasia. These are changes in that uterine lining that basically bubble wrap, for lack of a better term, that allow bacteria to hide. The vagina, remember that from that very first picture, it's directly under the anus. It's open to the outside world. It's not meant to be sterile. And so we have normal vaginal flora. And when that cervix is open, that bacteria can get into the uterus, hide in those little crevices and little bubbles that are now in that uterus. At the end of that cycle, that cervix closes and boom, we have a party. And so we're going to see pyometra about 4 to 6 weeks after that estrus cycle. More common in middle-aged girls that have never had puppies. And obviously, when we're going to be diagnosing these, we're going to be looking at, obviously, radiographs, ultrasound, vaginal cytology. There is a slight caveat, though, when we're looking at our x-rays. So in this particular image here, so what's circled in red, that is actually the uterus. Now, I can't tell you with 100% certainty that that's not a pregnant uterus. So pregnant uterus on an x-ray is going to look very similar to a pyometra at 30 days in gestation. And so x-rays are not something that I'm ever really going to jump to automatically. I'm actually going to be reaching for my ultrasound. So in this image here, this is a loop of the beautiful uterus. I've got another loop of the uterus here. We've got one of those beautiful little bubble wrap things right there, those cysts. And then this is another uterine horn as well. And so this uterus is absolutely full of pus. This is that same uterus, again, circled in red, at the end of her medical management. And we can see all of these like little bubble wrap issues and changes to that lining of that uterus. In vaginal cytology, she's got lots of white blood cells just because we've got an infection, we have inflammation. And now just because we have white blood cells doesn't necessarily always mean we have infection, just means I have a lot of debris and inflammation and some problems that we're having to clean up. This will come into play a little bit later on. All right, so now then, for pyometra, we can either have an opened pyometra or closed pyometra. Open pyometras are the ones you're seeing that vaginal discharge. They're not usually as sick, and because that nasty uterine discharge is open and draining, we're not going to have those big distended abdomens. However, on the flip side, with that closed pyometra, because we're not seeing any of that vaginal discharge, these have a tendency to get a little bit sicker before we ever get a chance to lay eyes on them, and they're going to be a little bit bigger. You know, they might have been bred, so they think that that abdominal distension is because they're pregnant, and then they can go downhill pretty quickly. So if we're considering medical management for these girls, I want these to be young, healthy females, somewhere between 2 to 4 years of age. The reason I have a bottom age on them is because they must be bred on their next heat cycle. I have seen some bitches, they come in to me at 6 to 9 months of age. They've only had one heat cycle, and all of a sudden now they've got a pyometra. They're not doing the traditional things, following the same, reasons as why pyometra occurs. And on these girls, it concerns me that we've got other reasons that pyometra is happening. And I'm really concerned that we might have something genetic that's at play here for these girls. That's causing a problem for them to have a pyometra so early in life. Also, if I have to breed her on our next heat cycle in another 6 months, I'm going to be breeding a year-old dog. And honestly, I'd rather them be older and more mentally and physically mature before we consider doing that. I do also like them to have an open pyometra so that uterus is open and draining. Not to say that we can't medically treat a closed pyometra. It is just not completely advisable because the medications we use to get all of that nasty discharge out of that uterus causes uterine contractions. And if I'm fighting against a closed cervix, so every time that uterus contracts and it has nowhere to go because that cervix isn't fully dilated, we run the risk of causing that uterus to rupture. So when we do medical therapy, they're in the hospital anywhere from 5 to 10 days. It really depends on how they're responding to the medications. We keep them on some pretty heavy hitting antibiotics. Prostaglandin is that medication that I was talking to you about that's going to cause those uterine contractions to help get all of that stuff out there. And we're going to be doing some ultrasounds on them to watch how they are progressing with their treatment. Is it working like we want it to? Prognosis, obviously, we want puppies. And most of the time, we're really good at being able to treat this. However, what we're treating is we're treating the infection that's in there. We are not treating that underlying cause of that cystic endometrial hyperplasia. Nothing I can do can treat that except getting new puppies in there to hopefully reshed that lining of that uterus so we can potentially move on with our lives or get more puppies out of these girls if we can. However, sometimes surgery is the way we need to go for these girls, and some reasons that we're going to consider surgery. Obviously, if their breeding career is over, regardless of their age, or if we have an older female, or this is a closed pyometra. And I had one that we did start with medical treatment. And after being on medical treatment for, 5 days, she just wasn't responding well. She wasn't handling the injections very well. So we made the decision that we were going to go ahead and have her spayed, unfortunately, just because she didn't respond to treatment like we would have liked to. So that's always an option too, as well. You know what? We started it, we tried it. She's not doing well. She's not handling it. We're going to go ahead and we're going to end the breeding career for her, unfortunately. So a couple of options on that one for you. All right. So going on to our postpartum complications. These are kind of my favorite ones. So agalactia, or basically a bitch that's not making any milk. And why this is important is we know it's very vital for those puppies to get good colostrum uptake in that first 24 hours. And if your bitch doesn't have any milk, it then makes it a lot scarier for these puppies to get some good colostrum into them. There are lots of medications out there that we can use to help with that. The fenugreek is something you guys can go pick up at the store. Most pharmacies carry fenugreek. It comes in 610 milligrams. You do that once a day until you have good milk production. Prescription medications, we have metoclopramide, which we use for a lot for like GI things, which helps with milk just a little bit. But my favorite medication is one that's called domperidone. This is actually one that we take from the equine world. and we use it to help make milk production a little bit faster and better. Now, the problem then is, what are we doing for the puppies? Obviously, they need still that good colostrum without mom having that. If you exist anywhere outside the US, Royal Canin actually does make a milk replacement formula that has colostrum. This is not available for sale in the US, so hit up your Canadian friends for this. Or we need to look at doing, serum or plasma for those puppies to making sure that we're getting good antibodies into their system for them. All right, uterine prolapse. So this is going to happen about 48 hours after they had the puppies. All right. This is absolutely a medical emergency. This happens more often in cats than it ever does in a dog, but it can definitely happen. And this is a picture of a cat. Unfortunately, I couldn't find a good dog picture. Definitely making sure that area stays nice and lubricated. We might be able to get that replaced manually, but most likely this is going to be, we're having to lose that uterus. The only reason I bring up uterine prolapse, as I said, it doesn't happen that often in dogs, but it's after they have had puppies. What I get phone calls about a lot of times is a vaginal prolapse or vaginal hyperplasia, as you might hear some veterinarians refer to it as. And they call and say, oh my gosh, her uterus fell out. And no, it's not her uterus. She's currently in heat. Okay. And so that's the difference with that. So vaginal prolapse happens while they're actively in heat. Uterine prolapse is after they have had puppies. Vaginal prolapses are considered heritable, and they will become worse with subsequent heat cycles. So if I had a dog that comes to me with this bad of a vaginal prolapse, I would decline from breeding her because I do know the heritability of this, and it is just going to get worse for these dogs. It's not really fair for them. All right, metritis. All right, so to orientate you on this picture, the dog's back is up here. That is her vulva, and then these are the mammary glands. So you have a dog who's coming in with foul-smelling vaginal discharge. She's running a fever. She's not eating. Kind of actually sounds like a pyometra, right? However, this is 2 to 3 days postpartum, and this is where the difference lies. Okay. Metritis is from inflammation in the uterus, usually due to a prolonged labor and or a dystocia. Either one can cause those. And so they're going to present almost identical to a pyometra. They're going to be running a fever, they're not wanting to eat, they feel like crap, and we've got this nasty bloody vaginal discharge that's coming out. So how are we going to diagnose this? All right, so x-rays, because the first thing I need to do is I need to make sure that there are no puppies that are stuck in them. That's the big one, because we can see that sometimes as well. And so in this x-ray, in red circled there, is that uterus. Now this bitch had puppies 24 hours prior to me taking this x-ray. So this is a normal involuting uterus. However, it looks very similar to that pyometra x-ray that I showed you at that 30 days. And so you can see where there's a lot of overlap with this. Now, a lot of people like to be able to do ultrasounds to look for a retained placenta. However, I don't really care. That's the great thing about dogs. Dogs do not usually retain the placentas. In horses, absolutely, a retained placenta is detrimental to the life of that horse. In a dog, that retained placenta is going to get broken down in the normal losha and is going to get kicked out. Absolutely. Can we do an ultrasound? Sure can. There you go. Circled in red is that normal involuting uterus. I can't tell you if there's a placenta attached to that. It all looks like a uterine wall for me there. So nothing major. I'm not going to waste your money on doing an ultrasound for you there. And of course, we can always do cytologies. It looks just like that pyometra. I've got a bunch of white blood cells that are there because they're there cleaning up the mess of everything that happened with that. So again, not something we have to do because it's not going to change how I'm going to treat your dog. But now you can see why it is very easy to confuse the pyometra and a metritis. So pyometra is going to happen after a heat cycle. Metritis is going to happen after she had puppies. So how are we going to treat metritis? So I'm going to put them on some antibiotics because they're running a fever. And I want to, take care of that fever. I'm also going to put them on some anti-inflammatories to help break that fever a little bit more. Oxytocin, so an injection we can kind of give them to act as like that clean out shot. However, if mom will tolerate the puppy's nursing and she's not that sick, and will let the puppies nurse, every time those puppies nurse, they're going to cause uterine contractions, and that's going to allow those uterus to kind of kick out any of those extra contents that are in there. So I may not have to necessarily give an oxytocin injection. Some severe cases, unfortunately, we can't get that fever to break. She's really down and dumpy. We may need to actually hospitalize them and do IV antibiotics. And in rare cases, we may actually need to spay just because we can't get this infection under control. And since everything is centered in that uterus, we may need to take that away from her, unfortunately. Last ditch effort. Obviously, we're going to do everything we can to avoid that for her. All right. Now that we've made it through the first couple of weeks of having puppies on the ground, the next thing we need to worry about, 2 to 3 weeks postpartum, something that's known as eclampsia or hypocalcemia, so low calcium levels. This is more common in our small breed dogs with large litters. So our little Yorkie here, for example. Things you're going to notice with this, they're going to have a stiffened gait because calcium is essential for muscle contractions. You might notice some behavior changes. It's an odd one, but it's actually a really good thing to key you in that something's wrong. And they can't go so far as to actually have seizures. And so that's the scary part. When they get to that point, then absolutely get them brought into us. So if they're just exhibiting any of these signs, definitely we want to get them started on some medications. And so if they come see me, I'm going to do some IV calcium for them if they're that bad. If it's still early and we're just noticing some behavioral changes, we can get them started on an oral calcium supplement. And the easiest thing to do is just some basic Tums. Obviously, trying to find a flavor that they want to eat, that's a little harder. There are other calcium supplements out there, but Tums is just a quick, easy one. Most people have that in their household. Obviously, if we're having issues with this because the bitch making the milk is such a drain on her, especially if she's not eating well and replacing those calories and the calcium in her diet, we may need to consider weaning the puppies early or helping to supplement them so mom's not having to do as much and is not putting as much of a drain on her. All right, mastitis. Okay, so mastitis, inflammation of the mammary gland. So we can see in this image, this mammary gland is hot and red and it hurts. So we may see some purulent milk. Some of my favorite things to do for mastitis treatment, hot compresses at home. So those warm compresses to it, that's going to help soften up that mammary gland, make that a little bit more comfortable for them. If I've got nasty purulent milk, I am going to put them on some antibiotics for a while, something that is safe for nursing moms so the puppies can still continue to nurse. If that mammary gland is still closed, like this one is in this image, letting your strongest nurser nurse from that actual affected gland can help drain it, and that can be very beneficial for them. Because they're usually running a fever, I also will put them on an anti-inflammatory medication for a couple of days to help break that fever. And the other thing I really love doing for these guys is something that's known as a cold laser. And so what that's going to do, it's going to speed the healing process of the mammary gland. It's either going to force it to rupture, which then she's going to feel so much better once it ruptures. They heal beautifully once they rupture. So don't think that, oh my God, you're a bad owner. If something happens along those lines, they will feel so much better once it's ruptured. It's out, it's open. You keep it covered, let the puppies keep nursing. But that cold laser is just going to really help speed that healing process for her to get her back to normal and kind of going back to being, a good mom again for you. All right, moving on to our boys. I'm just moving right along here. Okay. So BPH, well, this isn't truly a emergency for the boys. The things that you're going to see with this is blood dripping from the penis. And that's obviously going to exclude people in, oh my gosh, there's a problem. Now, the prostate is going to get larger over time. This is a normal aging change. So in our image here, we've got our normal prostate, nice and small. Over time, it gets enlarged because the urethra runs right through there from the bladder. You can see that blood that's just going to drip from the penis unassociated with urination. Also, because the prostate pushes up on the colon, you may notice a change in what their stools look like. If they're done with their breeding career, we can always go ahead and neuter them. That's going to allow that prostate to shrink back to this more normal size so the symptoms can go away. However, if we're not done with the breeding career, we can start them on a medication called finasteride. What finasteride is going to do, it's going to block the conversion of testosterone to dihydrotestosterone. And why that's important is testosterone is actually not what causes the issue. Testosterone helps us with our libido and making the sperm and all of that. But the bad things, the enlarged prostate, actually comes from the dihydrotestosterone. And if we can stop that conversion, we can still use him as a good stud dog for us. Now, when they're on this medication, we keep them on it until the breeding career is done, and then we go ahead and get them neutered so we can stop the medication. Another reason that you might see blood dripping from your male's penis is due to a urethral prolapse. Now, if this happens in your house, it might actually look like a murder scene just because the penis is a very vascular organ. And so you guys see what the normal penis looks like, and we've got this little red P that's sitting on the end of the urethra right there. And unfortunately, this happens in our young prepubescent boys because of sexual excitement. Very common in our bulldogs. It is highly overrepresented in our bulldogs. We do actually think that there's a genetic link there. We do also sometimes see this in our Yorkshire Terriers and Boston Terriers as well. So they're happy. There's all of these girls around and they're humping everything in sight. And then they end up with this urethral prolapse. And you have a bloodbath in your house, and I'm sorry. So how are we going to fix this? Sexual arrest, obviously. Getting the male out of the house, away from any estrus female is going to be ideal. Sometimes we actually have to sedate them and sedate them very heavily because the sedation, heavy sedation is actually going to cause that blood pressure to drop so that, can allow some of those blood vessels to shrink and kind of, hopefully keep the bleeding from happening. Unfortunately, once the urethra prolapses, it doesn't ever go away, and some males will need surgical correction. If this happens, once it is healed, and this can take a while for it to fully heal, they can go back into the breeding population, but just be cautious because we do worry in certain breeds about there being a genetic predisposition. And is this something you want to keep in your line? All right. And the other thing that we can see in our boys, testicular torsion. And so we can see looking at these two testicles of these male, we have one testicle that is significantly larger than the other testicle. Now, if this is a younger male who happens to be crypt orchid, they're usually going to have acute abdominal pain. They're going to be vomiting. They're just going to be so painful in that abdomen. And those males absolutely are going to have to be, you're going to need to neuter them immediately. And since they're crypt orchid, we know that is heritable. We're going to take both testicles. Now, if this is, an older dog, it's usually the testicular torsion is going to be because of a testicular tumor. The tumors change how they hang normally, and that's going to cause it to twist and rotate on itself. We can, in those particular instances, just take the affected testicle. Sometimes in younger dogs, for whatever reason, they have two scrotal testicles. One of them will twist. Happened in one of my other clients, and we went in and we just took the retained or the affected testicle. So he was still able to be bred because he had the one testicle still there, because this was more of a medical incident and not something genetic that we can talk about or come up with a genetic reason for. We just decided that that's going to be the okay reason. We'll get him neutered. He can still go back into the breeding population and hopefully not have any issues going forward. All right, now you've all heard those commercials about if you have an erection lasting more than 4 hours, please seek medical attention. And absolutely, there's a huge reason for that. So paraphimosis or priapism, two different variations of basically the same disease. The penis is unable to be withdrawn into the prepuce. This can happen in both neutered or intact males. This particular male pictured here was an intact male, and he was around a bunch of estrus females, humping everything in sight, and was put back into his kennel without making sure that he was completely put away into his sheath or his prepuce. And so he then traumatized himself to that point. So sexual excitement is the biggest one we can see. Obviously, there can be some sort of inflammation or trauma that can happen to the penis. In our neutered older males, we can see neurologic defects, so some spinal defects that can actually cause the penis just to kind of stay out more often than what it's supposed to, as well as if anybody in the household is on any topical hormonal creams, particularly estrogen. We have a tendency to put it on the inside of our forearm, and our dogs have a tendency, they lay next to us and they get absorb those creams as well, and it can definitely affect them. Where obviously we want to treat the underlying cause, potentially neuter them as if not pup already, sometimes for these boys, keeping that penis lubricated and hopefully getting it put back into that sheath as quickly as possible. Unfortunately, our male friend did have to have part of his penis amputated. And depending on what his underlying cause is going to be how they're going to do with this. Some males, once we get that penis decompressed and back into the sheath, they can do fine and never have another incident ever again. Just depends on the boy. So for our males, obviously we know that everything kills sperm. So if we have any type of emergency for our boys, we want to make sure that we get them seen immediately, because this can definitely affect his sperm production. And after they've had any insult to the testicles, like a hot spot on the testicles or anything along those lines, that extra heat, the dog's running a fever, it's going to affect future sperm production. And so when we look at our little graphic here, oh, I'm just drawing lines now. So down here at the basement membrane, these are the basic little cells that eventually become our sperm. And once they get to this stage, it's been 60 days. And so anytime they've had an incident or anything that causes pain, trauma to those testicles, and you know you're going to be breeding him, and all of a sudden 2 to 3 months later, and he doesn't have the best sperm quality, you always have to think what happened 2 months before. So always, anything's going on with the boys, get them seen, get them treated immediately, just because we know that we can absolutely lose some sperm issues in the future that we don't have to worry about for them. And with that, I will take any questions. My email is up there for the clinic, so feel free to shoot me some other questions if I didn't answer anything for you today.
Great. Thank you so much. We do have a lot of questions. I will try to focus on the emergency related ones. We have some more general theorio ones that if we have time, we can get there, but I don't know if we will. So like Dr. Barstow mentioned, the email is there. Should you have additional questions. I thought this was a good general one to start with. How close would you recommend people be to an ER or repro vet before considering a scheduled C-section? What's your kind of comfort level and travel of what may be medically managed, or if you have to rush to a hospital, what would you like to see in terms of proximity?
Dealing with medical emergencies, I like to knowing who you can call that will be willing to do an emergency C-section on your dog, particularly after hours. That's always a very nice thing to know. That's not going to require a spay. So talk to your local emergency clinics and know who's around you who can assist you with all of that. I like to see them have puppies every 2 hours. And by the time I get to that 2 hour mark, if I haven't had a puppy, that's usually when I get the bitch packed up in the car and start heading somewhere, just because it's not uncommon that they'll have a puppy in the interstate on the side of the road. Have that happen all the time. But by the time you get somewhere, you get seen, you get evaluated. That way you can be pushing the 4 hour mark between puppies, that we know we can safely have better puppy survivability. Obviously, the closer you are, the better. But if we're scheduling a C-section, then we're usually going to be seeing you daytime hours, and that's a little bit easier to handle versus those emergency situations. But knowing where your closest emergency clinics are is going to be very beneficial for you.
Absolutely. Thank you. You answered another question with that answer. So fantastic.
Okay.
I know you mentioned the time in between puppies. Someone else with a specific question relating to how many hours do you wait for the first pup to come? Is it still that timeline, or does that change?
So that fourth puppy can take a little bit longer. So when I'm looking at that bitch, obviously, if she's just kind of uncomfortable, that first stage of labor can take anywhere from 12 to 24 hours is what the textbook says. I get a little uncomfortable when we kind of start pushing that 24-hour mark, but as long as she's not doing anything, once we start getting these weak intermittent contractions, I want that first puppy out within 4 hours. Once we have that heavy bearing down, pushing, and nothing's happening, that's 30 minutes. That's my time frame on that. And then once we get that first puppy out, then I want a puppy every 2 hours.
All right. Fantastic. Thank you. I think we have time for just a couple more questions. Looking through here. I know you touched on this, but possible early indications for pyometra. So maybe not telltale signs, but or clinical signs, but things people should keep an eye out for if they're concerned.
So why I love my breeder vets, you guys are very intimately familiar with your dogs. So my dogs love ice cubes, and I know when they don't want an ice cube, something's kind of off. So monitoring their behavior, their changes, and just keeping an eye on them, it's not going to hurt to get them in for an ultrasound a little bit sooner. The pyometra that I talked about, when we saw her, she was 18 days post-breeding, so significantly earlier than a traditional pyometra. But she had just a tiny bit of drop of blood. Owner was concerned, brought her in, and we were able to kind of jump right on it. So just kind of watching for just behavioral changes, discharge out of the ordinary. They're not eating some things that we know that they might do, but just kind of, keeping a real close eye on them.
Great, thank you. And we'll finish with this one. Do you have any just general advice for breech births? So we had someone that was looking for recommendations there.
I know a lot of people have a tendency to use the term breech. And if I can actually go back to that x-ray image. Sorry, that was farther back than I thought it was. It's at the beginning here. Okay, so in this x-ray image here, this puppy is actually not coming out head first. He's coming out rear feet first. And in dogs, that's okay. They can either come out head first or rear feet first. So a true breech is going to be like the back or the stomach coming towards them. So this doesn't bother me. They're absolutely allowed to come out rear feet first. And if that's what you're meaning by the breech, perfectly acceptable and normal. This in an x-ray does not bother me in any way, shape, or form. It's completely normal for dogs to do that.
Amazing. Thank you so much, Nicole. I'll turn it over to you.
Great, thank you. Thank you both for such a great Q&A. This was an amazing presentation, and just glancing at our Facebook chat, I think our community agrees. Everyone absolutely loved this. Thank you all for asking such wonderful questions. And if you are not yet a member of our community, I invite you to apply to join at gooddog.com/join, so you can stay up to date on all of our future webinars just like this and exclusive events. Dr. Barstow, thank you again for being here. We love having you. We're going to have you back again with us soon because people have so many questions for you.
It was beautiful. Thank you guys so much for having me today.
Of course. And for everyone joining, probably wondering when our next webinar is, it's coming up very soon. I'll give everyone a sneak peek here before we officially announce it to the community. It's going to be on Wednesday, March 19th at 1 p.m. Eastern. And the topic is Probiotics, Your Gut Health Toolbox with Dr. Martha Klein. So a little bit different topic than we've been covering lately with reproduction, but very excited to get everyone's gut health questions answered there. And that's where Dr. Hester will be joining us again for session 3 of our Breeding Masterclass series, where she's going to hopefully be covering the first week of puppy care and desensitization. So very different than what we covered during this session. We're really excited for that. Until then, thank you all so much again for being here. Thank you, Dr. Barstow, and we will see you at our next presentation. Bye, everyone. Thank you.